Welcome back to Simply Women's Health with CJ. Today I want to talk about a very common concern during pregnancy, pelvic pain, which does tend to go hand in hand with lower back pain, especially in the third trimester. After all, you have a tiny human who is growing in your pelvis, who's getting bigger and stronger every day, putting a lot of pressure on that pelvis. So this is actually what the female pelvis looks like. Notice that there's a piece of cartilage right here in the front that's called the symphysis pubis. Men don't have that cartilage. In the third trimester, your placenta ramps up the production of a hormone called relaxin. The job of the relaxin is to soften up this cartilage so that your pelvis can expand, getting a baby through. That hormone also goes to your SI joints, your sacroiliac joints, which is why the lower back pain. So what can you do about this? Number of different things. First of all, I recommend that you take a nice warm bath with Epsom salts. You can try massage, you can try wearing flat-soled shoes. I recommend you use a pregnancy support belt if you can get one. Try doing pelvic tilts. Get on your hands and knees. Keep your back nice and flat. Arch it like a cat. Come back to a nice flat or neutral position. You can ask your provider for pregnancy-friendly medications if that helps. I also recommend trying physical therapy or chiropractic care. The good news is most of this pain will be completely resolved by 3 months after you have the baby. If it has not resolved after 3 months, I highly recommend you consider pelvic floor physical therapy. Now, here's when you would be concerned. If you have a sudden onset of pelvic pain that doesn't resolve with rest, if you are running a fever, if you are having vaginal bleeding, if you are lightheaded to the point of passing out, please contact your provider right away. Have you had pelvic pain? What's worked for you? Please leave your recommendations in the comment section below. And if you have any questions, I'm happy to answer those for you. While you're in that comment section, if you would be so kind as to hit that like button, I'd really appreciate that.
You're still here. Thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.